Is Gaurav Sharma with the evening news. The headlines. India records highest ever single day COVID-19 recoveries of 51,255 cases. Centre asks states and union territories to allow hospitalized COVID patients to use smartphones and tablet devices. Government issues fresh guidelines for international passengers arriving in India from 8th August. NIA arrests 6 more people in Kerala gold smuggling case. Khadi Agarbatti Atmanirbhar mission approved by government to generate employment and make India self-reliant in Agarbatti production. And in Bihar, relief and rescue operations in full swing in 14 flood-affected districts. A record 51,255 recoveries have been registered in the country in the last 24 hours. This is the highest number of recoveries in a single day since the outbreak of the pandemic in the country. With this, the recovery rate has improved to 65.43%. The case fatality rate has further declined to 2.13%. The Health and Family Welfare Ministry said a total of 11,45,629 people have recovered from COVID-19 in the country so far. 54,735 new cases of coronavirus have been reported in the last 24 hours, taking the total number of cases to 17,50,723. Presently, the total number of active corona cases in the country is 5,67,730. In a single day, 853 deaths have also been reported, taking the nationwide toll to 37,364. The central government has written to all states and union territories asking that smartphones and tablet devices be allowed for hospitalized COVID-19 patients so that they can interact with family and friends through video conferencing. It will provide them psychological support. Though mobile phones are allowed in hospital wards, the letter was issued following some representation from the kin of patients alleging that mobile phones are not being allowed by hospital administrations. In a letter to the Principal Secretaries of Health and Medical Education of states and union territories, Director General of Health Services in the Health Ministry, Dr. Rajiv Garg said, appropriate protocols for disinfecting devices and allotting time slots can be developed by the concerned hospital to facilitate contact between patients and their family.
The Health Ministry has issued fresh guidelines for international passengers arriving in India, which will be operational from the 8th of August. The guidelines state that before planning for travel, all travellers should submit a self-declaration form on the online portal newdelhiairport.in at least 72 hours before the scheduled travel. They should also give an undertaking on the portal that they would undergo mandatory quarantine for 14 days. This includes 7 days paid institutional quarantine at their own cost, followed by 7 days isolation at home with self-monitoring of health. Home quarantine may be permitted for 14 days only for compelling reasons such as pregnancy, death in family, or serious illness. Travellers may also seek exemption from institutional quarantine by submitting a negative RT-PCR test report upon arrival. The test should have been conducted within 96 hours prior to undertaking the journey. Before boarding, do's and don'ts will be provided along with ticket to the travellers by the concerned agencies. States can develop their own protocol with regards to quarantine and isolation as per their assessment post-arrival of passengers in the state.
Home Minister Amit Shah has tested positive for coronavirus. In a tweet, Mr. Shah said his health is fine, but he is getting admitted in hospital on the advice of doctors. He said he got tested after developing symptoms of COVID-19. The Home Minister requested the people who came in contact with him to self-isolate. Leaders from different political parties have wished a speedy recovery to Home Minister Amit Shah. BJP President J.P. Nadda, former Congress President Rahul Gandhi, AAP convener and Delhi Chief Minister Arvind Kejriwal, TMC President and West Bengal Chief Minister Mamata Banerjee, BJD President and Odisha Chief Minister Naveen Patnaik, and others have wished good health to Mr. Shah. Several union ministers, including Rajnath Singh, Dr. Harshvardhan, Piyush Goyal, Prakash Javadekar, Ramvilas Paswan, Harsimrat Kaur Badal, Ravi Shankar Prasad, along with the Chief Ministers of Gujarat, Rajasthan, Punjab, Madhya Pradesh, Karnataka and others, have also wished the Home Minister a speedy recovery.
Tamil Nadu Governor Banwari Lal Purohit has tested positive for COVID-19 infection. A health bulletin issued by the Kaveri Hospital in Chennai said the governor has been advised home isolation as his infection is mild. His health will be monitored by a team of doctors. Meanwhile, in Tamil Nadu, the total number of COVID-19 affected people has crossed 2,57,000 with over 5,800 new cases reported today. Uttar Pradesh Cabinet Minister Kamla Rani Varun passed away today at PGI Hospital in Lucknow after battling COVID-19. She was 62 years old. The President, Prime Minister, Defence Minister and the State Chief Minister have expressed grief over the demise of the minister. In a tweet, President Ramnath Kovind said, Kamla Rani Varun was very well respected for serving people at the grassroots and had also served as an MP in the Lok Sabha twice. Prime Minister Narendra Modi in a tweet said, Kamla Rani's entire life was dedicated to social service. He said she played an important role in strengthening the BJP in Uttar Pradesh.
Coronavirus cases are steadily increasing in rural Maharashtra, and these cases are adding to the state tally when the number of cases are reducing in the biggest hotspots. After the process of unlock, industrial units are becoming hotspots as the infection is spreading quickly among the workers, and this has become the cause for concern for the state. More from our correspondent.
As many as 120 workers of a firm in Chakan area of Pune district have tested positive for coronavirus in a single day. The firm had on its own sent swab samples of around 900 employees for testing 2 days ago. The district administration has asked the firms in the Chakan MIDC area not to allow the employees who live in containment zones to report for work at present. Similarly, 19 workers from a power generation group in Gondia district were found positive out of total 60 positive cases registered today in the district. The firm has kept its 400 laborers under home quarantine. Many districts in Maharashtra are showing rising trend in coronavirus cases, but due to the improved recovery rate, people are coming forward to test themselves and getting the treatment in time. Shailesh Patil, AR News, Mumbai.
Meanwhile, megastar Amitabh Bachchan has cured from COVID-19 and he was discharged from Nanavati Hospital in Mumbai today. Earlier, he said that he had tested negative for COVID-19 and will now be quarantining at home. However, his son Abhishek Bachchan has not yet recovered and is still admitted in the same hospital. Kerala continues to record a surge in COVID-19 cases with 1,169 fresh cases confirmed today. Our correspondent has filed this report.
The State Health Department informed out of the new cases, 991 persons contracted the virus through local transmission. The situation in Thiruvananthapuram is getting extremely serious as 377 new COVID cases were confirmed today, among which 363 cases are through local transmission. The death toll in the state due to COVID touched 82 as one more death was confirmed today in Thiruvananthapuram district. Meanwhile, 688 people recovered from the virus infection today. The total active COVID cases in Kerala rose to 11,342. The Department predicts heavy rain in the coming days in the state. Orange alert issued in 4 districts for tomorrow. Mayusha for AR News from Thiruvananthapuram.
In the Union Territory of Puducherry, the recovery rate from COVID-19 has increased to 60.66%, while the mortality rate is 1.4%. Our correspondent has more details.
According to the COVID-19 status report for today, released by the Puducherry Health Department, as many as 200 persons were tested positive for the coronavirus disease and 1 person died in the last 24 hours, leaving 1,445 active cases. Of the 200 new cases, 161 cases were reported in Puducherry region, 7 in Karaikal and 32 in Yanam region. So far, 3,806 persons were infected by the virus, of which 2,309 were treated and discharged and 52 died. Presently, no COVID cases are there in Mahe region of the Union Territory. Chandramohan, AR News, Puducherry.
In Assam, the second plasma bank was inaugurated today at Tezpur Medical College. Health Minister Himanta Biswa Sarma inaugurated the plasma bank. He said that already 3 patients have donated plasma. The minister assured that efforts are on in the state to conduct more number of rapid antigen tests. In a tweet, the minister said that with 0.24%, Assam has recorded the lowest mortality rate in the country. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Director at AIIMS in Delhi, Dr. Randeep Guleria advised people to aggressively follow the social distancing and hand hygiene norms to check the spread of COVID-19 infection.
Regular hand washing should be done. So those who in an area where there is coronavirus infection should wash their hands regularly. You should avoid going to crowded places because if someone in the crowd is coughing and has the infection, he can spread to others in the crowded places. And if any member in your family has fever, cough, cold, he should stay at home and avoid going out so that he doesn't spread the infection to other people in the community.
Dr. Rakesh Garg of AIIMS in Delhi said that the spread of COVID-19 infection takes place through a person having a travel history as well as from those who have come in contact with the infected person.
सबसे ज्यादा मायने वाली चीज ये रखती है कि हम कोविड-19 की सस्पिशन उस पर ज्यादा डिपेंड करेंगे अगर उसकी कुछ ऐसी जगह से ट्रेवल की हिस्ट्री है जहां पर पॉजिटिव केसेस थे, एंडेमिक एरिया था, या फिर उनका ऐसे कांटेक्ट हुआ है किसी पेशेंट से जो ऑलरेडी पॉजिटिव था, ये सस्पेक्ट था, या फिर ऐसे पेशेंट की जो देखभाल कर रहा है जो कि पॉजिटिव है, ये सस्पेक्ट है। तो अगर ये हिस्ट्री पॉजिटिव है और साथ में सिम्टम्स भी हैं तो उसमें चांसेस कोविड-19 के होने के रहते हैं।
The News Services Division of All India Radio and its bilingual live phone-in program tonight will bring you a special discussion on COVID-19. Dr. Neeraj Gupta, Professor of Respiratory Medicine at Safdarjung Hospital, will participate in the discussion. This can be heard tonight on FM Gold channel and additional frequencies from 9:30 p.m. onwards. Listeners can ask questions to the expert on toll-free telephone number 1-800-115767. You can also ask questions on telephone number 011-233-14444 and post your queries on our Twitter handle at AIR News Alerts by #AskAir.
You're listening to the evening news on All India Radio. A reminder of the headlines before we move on. India records highest ever single-day COVID-19 recoveries of 51,255 cases. Centre asks states and union territories to allow hospitalized COVID patients to use smartphones and tablet devices. Government issues fresh guidelines for international passengers arriving in India from 8th August. NIA arrests 6 more people in Kerala gold smuggling case. Khadi Agarbatti Atmanirbhar mission approved by government to generate employment and make India self-reliant in Agarbatti production. And in Bihar, relief and rescue operations in full swing in 14 flood-affected districts. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
The NIA has arrested 6 more people and conducted searches at 6 places in connection with the Kerala gold smuggling case. The agency has so far arrested 10 people in the case of smuggling of gold through diplomatic baggage addressed to the UAE consulate in Kerala capital Thiruvananthapuram. During searches, 2 hard disks, 1 tablet computer, 8 mobile phones, 6 SIM cards, 1 digital video recorder and 5 DVDs were seized, besides various documents including bank passbooks, credit and debit cards, travel documents and identity documents of the accused. Further investigation in the case is continuing. Foreign portfolio investors remained net buyers for the second consecutive month in July by pumping in 3,301 crore rupees in the Indian markets. According to the depository's data, a net sum of 7,563 crore rupees was invested in equities, while 4,262 crore rupees were withdrawn by FPIs in July. The net investment during the month stood at 3,301 crore rupees.
MSME Minister Nitin Gadkari has approved a unique employment generation program proposed by Khadi and Village Industries Commission KVIC to make the country Atmanirbhar in Agarbatti production. The program, named as Khadi Agarbatti Atmanirbhar Mission, aims at creating employment for unemployed and migrant workers in different parts of the country. The pilot project will be launched soon, and on full-fledged implementation of the project, thousands of jobs will be created in the Agarbatti industry. The Women Entrepreneurship and Empowerment WEE cohort initiative helps women ranging from college-going students to middle-aged housewives to take up entrepreneurship as a viable, fulfilling career option. It is India's first of its kind initiative to strengthen women's ecosystem at IIT Delhi, supported and sponsored by the Department of Science and Technology. The cash awards in the form of a grant totaling 25 lakh rupees have been presented to 11 women entrepreneurs. Aparna Saraogi, co-founder of WEE, talked to AIR News about the initiative.
As we all know, the startups founded by women are more innovative, sustainable and has less non-performing assets. But unfortunately, our contribution to startup world is around 15 to 20%. Imagine a world where we have more and more startups from women, and that's the only way our country can move to the developed. So we thought of creating a platform where women entrepreneurs across the country from different sectors come together and support and enable each other.
Kalpana Arora, who has done a doctorate in wastewater management from IIT Delhi, has been awarded for her products like sanitizers from wastewater. She is a social entrepreneur and works for tribal women and farmers in the hilly region of Uttarakhand through self-help groups. Talking to AIR News, she said her journey with WEE helped her meet a community of like-minded individuals.
WE is an amazing program for promoting women entrepreneurs, and it was an amazing journey throughout. It developed my self-confidence and taught me to start believing in myself and my business idea. WE is a place where we had developed a community of people who are like-minded in their ambition but completely unique in their experience, creating new learning experience in each class. Connecting to the people who have been gone through the same phase as of ours boosts us morally. The journey with WE is an incredible experience with learning for lifetime.
Union Minister of State for Communications Sanjay Dhotre today inaugurated Bharat Air Fiber Services at Akola in Maharashtra. With the inauguration of the services, residents of Akola and Washim districts will get wireless internet connections on demand, while BSNL will be increasing its customer base with these high-technology services. At the same time, it is giving a great opportunity to local residents of the districts to join hands with BSNL as telecom infrastructure partners. They will earn a regular monthly income of about 1 lakh rupees, thereby becoming self-reliant under Atmanirbhar Bharat initiatives of Government of India. In the run-up to the 74th Independence Day, we bring you a special story about Swachh Bharat. The Swachh Bharat mission has focused on rural and urban areas separately and played a crucial role in ensuring sanitation in the country. Since the launch of the mission in 2014, more than 10 crore individual toilets have been constructed across the country, and as a result, rural areas in all the states have declared themselves open defecation free on 2nd October last year. We have a report.
To ensure that the open defecation-free behaviors are sustained, no one is left behind, and that solid and liquid waste management facilities are accessible, the Swachh Bharat Mission Rural has moved towards its second phase, which is also called ODF+. This phase will continue till 2024-25. The Swachh Bharat Mission Urban has also made remarkable progress in the area of both sanitation and solid waste management. Over 4,324 urban local bodies have been declared ODF in the country so far. More than 66 lakh individual household toilets and over 6 lakh community and public toilets have also been constructed or are under construction. In the area of solid waste management, 96% of wards have 100% door-to-door collection, while 66% of the total waste generated is being processed. Divakar, AIR News, Delhi.
In an exclusive interview with AIR News, Dr. Bindeshwar Pathak, the founder of Sulabh International Social Service Organization, said that India has made remarkable progress under Swachh Bharat mission since the inception of government's Mega Clean India drive.
Mahatma Gandhi wanted a clean country. So he said, I want clean India first and independence later on. So that was the commitment of Mahatma Gandhi. The way now it is being handled and Prime Minister has given attention, it was not earlier. But now it has picked up and it is working very well. And I think now every house has a toilet and there is a campaign for this. This is very important, Swachh Bharat campaign. So every Indian is concerned. So that way there is a good campaign going on in India about keeping India clean and good. It is a good progress.
For the full interview, listen to the Spotlight program on FM Gold channel and additional frequencies from 9:15 p.m. onwards. In Jammu and Kashmir and Ladakh, Swachh Bharat Mission has played a significant role in mitigating the issues of the poor population, particularly ensuring and addressing the sanitation issues in the rural areas of the two union territories. Due to the sustained efforts of all the stakeholders, including Panchayati Raj institutions, 100% toilet coverage has been ensured for generating a positive frame of mind, which is crucial for making the people of both the union territories lead a purposeful life. With the measure of making both the union territories as 100% open defecation free, the problems have been addressed enormously. More from our Srinagar correspondent.
Jammu and Kashmir and Ladakh were declared open defecation free in the month of September 2018, quite 1 year in advance, by the then Governor Satyapal Malik of the erstwhile state of Jammu and Kashmir, all the 20 districts in Jammu and Kashmir and 2 districts in Ladakh division, 7,565 villages and 4,171 Gram Panchayats in both the union territories were declared 100% open defecation free as per Swachh Bharat Mission Gramin guidelines. Apart from constructing 1.1 million individual household toilets and 1,350 community sanitary complexes, the Swachh Bharat Abhiyan in Jammu and Kashmir and Ladakh union territories have played a vital and significant role in bringing about a behavioral change on the minds of the people. This is Sunil Kohl for AR News from Srinagar.
The government is working to strengthen grassroots democracy and give people a voice in Jammu and Kashmir. Everywhere, Gram Sabhas are being organized, developmental works are being planned, approved and executed at grassroots level with the enthusiastic public participation. This can be attributed to the path-breaking decision of conducting Panchayati Raj elections in 2018. We have a report.
The 9-phase Jammu and Kashmir Panchayati Raj elections in 2018 witnessed a record voter turnout of 74.1%. This was instrumental in kick-starting the grassroots developmental phase of rural Jammu and Kashmir. Out of total 4,483 Sarpanch constituencies, 3,650 Sarpanches were elected, and out of 35,029 Panch constituencies, as many as 23,660 Panches emerged as winners. 3,395 panchayats were duly constituted. Wherever panchayats could not be constituted, administrators were duly appointed for running the affairs of the panchayats smoothly. Prior to the Panchayati Raj elections, the government took a slew of landmark decisions and brought about much-needed amendments to strengthen and empower the rural local bodies in real sense. With Dipendra Kumar, Suparna Saikya, AIR News, Delhi.
In Bihar, the flood situation has further worsened in the northern parts of the state following rise in the water level of Gandak, Buri Gandak, Bagmati and Adhwara group of rivers. Over 55 lakh people across 14 districts are reeling under the impact of the devastating floods. The worst affected is Darbhanga, where about 17 lakh people have been affected. The other affected districts are Muzaffarpur, Samastipur, Sitamarhi and East Champaran. 49 people have lost their lives in flood-related incidents in the last 24 hours. Relief and rescue operations have been intensified. 31 teams of NDRF and SDRF have been pressed into service. Over 4 lakh people have been evacuated so far. 30,000 people are taking shelter in relief camps. The flood situation has improved in Assam. There were no rains in the past 36 hours in the state. However, 10 lakh people are still affected in 20 districts. 29,000 people are staying at relief camps. 109 people lost their lives due to floods in the state. Relief material including rice and pulses are being distributed at affected areas.
President Ramnath Kovind and Vice President M. Venkaiah Naidu have greeted the people on the eve of Raksha Bandhan. In his message, Mr. Kovind asked everyone to take a pledge to stand for the honor and dignity of women so that they can contribute their best for the nation and the society. In his message, Mr. Naidu expressed hope that this festival will bring peace, harmony and prosperity in the country. In a massive show of love, solidarity, brotherhood and national bonding, sisters from North-East region tied Rakhi on Jawans from armed forces and paramilitary personnel deployed in Jammu and Kashmir and Ladakh. On the auspicious occasion of Raksha Bandhan, self-help groups from the 8 North-East states also sent Rakhis tricolored bands and face masks to Jawans posted in Jammu, Kashmir and Ladakh, bringing together the eternal emotional bond between the various cultures, states and people of the country. A symbolic Rakhi ceremony was also held in New Delhi today, in which sisters from northeast states tied Rakhis to Donor Minister Dr. Jitendra Singh.
The first ever special program in Sanskrit to mark the World Sanskrit Day is to be broadcast by All India Radio tomorrow. The 20-minute program titled Bahujan Bhasha Sanskrit Bhasha will be broadcast at 7:10 a.m. tomorrow on 100.1 FM AIR News Live 24/7 FM channel. The live streaming will be available on www.newsonair.com, on Twitter at AIR News Alerts, News on AIR app and News on AIR official YouTube channel at the same time.
संस्कृत दिवस पर सुनना न भूलें आकाशवाणी द्वारा प्रस्तुत विशेष कार्यक्रम बहुजन भाषा संस्कृत भाषा सोमवार प्रातः 7:10 से FM समाचार चैनल पर।
The meeting of the Governing Council of the Indian Premier League is underway in Mumbai. The meeting is being held to give a final shape to the schedule and discuss other arrangements for the eagerly awaited events to be held in the UAE this year. The meeting is reportedly being attended by the top BCCI brass, including President Saurav Ganguly and Secretary Jay Shah, among others. The tournament, forced out of the country due to the raging COVID-19 pandemic, will be held from September the 19th to November the 8th. Meanwhile, Indian cricketers, including ODI captain Mithali Raj, have welcomed BCCI President Saurav Ganguly's announcement that the Women's IPL will take place during the Men's League in the UAE. While it is expected that most franchises will send their recce teams to the UAE to check out the facilities as well as the biosecure environments that can be created, there are concerns that remain, including accommodation plan and catering services.
Now let us take a look at the weather forecast for tomorrow. The national capital Delhi will have generally cloudy sky with light rain or drizzle. It will have a minimum temperature of around 27 degrees Celsius and a maximum of 38 degrees. Mumbai will experience a generally cloudy sky with moderate rain. The minimum temperature will be 25 degrees Celsius and the maximum temperature will be around 32 degrees. Chennai will have a generally cloudy sky with light rain. The temperature will hover between 26 and 35 degrees Celsius. Kolkata will have partly cloudy sky with 1 or 2 spells of rain or thunder showers. The minimum temperature in the metropolis will be around 29 degrees Celsius while the maximum will be 35 degrees. On to the north, in the Union Territory of Jammu and Kashmir, the minimum temperature will be 22 degrees Celsius in Jammu, while the maximum will be around 34 degrees Celsius. The city will have a partly cloudy sky with 1 or 2 spells of rain or thunder showers. In Srinagar, the minimum temperature will be around 18 degrees, while the maximum will be 32 degrees. The city will have mainly clear sky, becoming partly cloudy towards afternoon or evening. Ladakh will have mainly clear sky, becoming partly cloudy towards afternoon or evening. The temperature will hover between 13 and 29 degrees Celsius. In Gilgit, the temperature will hover between 17 and 34 degrees Celsius. In Muzaffarabad, there will be partly cloudy sky with 1 or 2 spells of rain or thunder showers. The minimum temperature will be 22 degrees Celsius, while the maximum temperature will be around 36 degrees.
And now, before we end the bulletin, the headlines once again. India records highest ever single-day COVID-19 recoveries of 51,255 cases. Centre asks states and union territories to allow hospitalized COVID patients to use smartphones and tablet devices. Government issues fresh guidelines for international passengers arriving in India from 8th August. NIA arrests 6 more people in Kerala gold smuggling case. Khadi Agarbatti Atmanirbhar mission approved by government to generate employment and make India self-reliant in agarbatti production. And in Bihar, relief and rescue operations in full swing in 14 flood-affected districts. For details of these stories and more, log on to our website www.newsonair.com. And with that, we end the evening news.